At the University of Wolverhampton, we've been doing research into the health and well-being of dancers since the 1990s. And it's mainly focused on the health of the dancer, their training load that they work with, and supplemental training. Because they train indoors, they get very little exposure to sunlight, and they've been having very low levels of vitamin D. This led to a number of intervention studies where we looked at, if we give them vitamin D, what the benefits are. And one of the things we first noted was actually that they seemed to have an increase in jump height and also reduced injuries. So within dance, one of the biggest cause of injuries is jumping, and this has led us to work with a dance school through one of our PhD students to develop a new neuromuscular preparation for dancers. And that's how, again, shown that we've actually reduced injuries by doing this beginning of the day. That actually helps them prepare them for jumping. One of the big projects we've been working on over the last 10 years is with the dance school over in Holland. One of the things we found was that dancers were always fatigued. When we looked at what they were doing, they seemed to be training for stupidly long hours compared with sports people. And so what we did was implement a new method of looking at how we trained them over a 4-year period, a bit like the Olympic cycles. Suddenly the dancers were dancing better and they got better jobs. And the Dutch government recognised this with giving an award to the school for that sort of innovative practice. And they're still going, and we're still collecting data and working with them when we're finding this sort of project.